Well, today being World AIDS Day, a day that has been celebrated since the 1st of December in 1988 to raise awareness of the AIDS pandemic and to also mourn those who have died from the disease. According to the UN's AIDS 2023 statistics, close to 40 million people across the world are living with HIV, and of those, about 77% are receiving the life-saving antiretroviral treatment. In sub-Saharan Africa, women and girls of all ages accounted for 62% of all the new HIV infections. I'm joined now by medical doctor in Ghana, Dr. Hannah-Lisa Tettehhas, for an in-depth look at HIV infections in Africa. We thank you so much for your time this afternoon, Dr. Hannah. Just your reaction when you look at how far the world, particularly Africa, has come in responding to this pandemic, especially in the past 25 years.
Thank you for having me. Well, I think that Africa has done something, but it's still not enough. We're still struggling with the issues of culture, with the issues of religion, and all sorts of beliefs. And that affects whether or not people get tested, and even when they're positive, whether or not they'll take the medication and further treatment. And so, in as much as we are trying our best, or efforts are being put in to reduce the pandemic in Africa, I don't think that we've reached where we're supposed to have reached on the global scale.
How do we look at this at a holistic, give it a holistic approach? I mean, you speak of some of the societal issues that we face when it comes to patriarchy, gender power plays, and some of the norms that we believe as communities, especially here in Africa. I mean, people go to school, they are taught how to look at this in different ways, but that doesn't seem to put a dent in the numbers that we are seeing. The numbers have decreased, but not at the rate that the United Nations was hoping it would reach.
So yeah, one of our challenges is, do we actually believe that we have it? Do we actually believe that it exists? We saw that in COVID. Most people didn't actually believe that it existed. So that's one of our major challenges, educating people to actually believe that it exists. Now, because of the stigma and discrimination associated with being diagnosed with HIV, you hardly get people actually coming out to advocate or to show themselves as people who have the disease. So there are lots of people who actually believe that it doesn't exist in the first place. So if people don't believe that it exists, then why should they actually go for medications for it? Initially, the issue was finances, but most African countries have been able to get funds, aids, or have been able to get some form of put it on some form of policies. Like in Ghana, it's been put on the National Health Insurance Scheme, so it's free. Medications are free in some countries, but then again, the issue of if they don't believe that it exists, will they actually go for the medication? Aside that, what kind of family system is there? So if you're in a family system where the man has to actually decide if you go for medications or if you actually can't take it, then it becomes an issue. So you are diagnosed, you want to go for the medication, but your husband says, don't go. We have areas where they value marriage and the family system so much such that they can't even tell their partners. And when they tell their partners, they know that their partners are going to leave them. So they won't tell at all. They won't go for the medication. And then they would rather wait for it to go into AIDS. And then that eventually kills them. So I think that some of these factors are what is preventing our numbers from declining as much as it has happened in other Western worlds.
And what would you attribute that skepticism to? I mean, over the years, there's been awareness campaigns across the continent, indigenous knowledge systems that people have been made aware of, people that come from marginalized communities, but there's still that sticking point, because at the end of the day, with all the interventions that have been created, if people do not believe that this virus is real and could actually kill, where do we start from?
So I think this year our theme is basically on educating people on their rights. So it's still awareness and education. It's desensitization. It is debusting the myths that exist. So people believe it doesn't exist, encouraging more people to come out and to be advocates, reducing stigma and discrimination. That's a major problem, stigma and discrimination, especially here. And then trying to desensitize people about the extent to which they should allow their religion apply to their medications and their health. So I think these are some of the things that we are doing and we are trying to do to still reduce the numbers. And as much as it hasn't come down as much, I think that is progress. It's just that it's a bit of a baby steps or crawls, but I think that we're getting there. Maybe it will take a longer time, but maybe we'll get there eventually.
Yeah, and the point of stigmatization that you raise is a very important one, because I will tell you, even sometimes with the most, what you would assume are educated people, you hear some of the most ignorant comments about HIV and AIDS coming from them, and it appears it trickles down to generations and generations. There is what is called the Global Alliance to End AIDS in Children by 2030. I mean, as Newzroom Afrika, we had a piece yesterday from my colleague Sipakema, who was speaking to mothers that are in marginalized communities that do not have the kind of resources that other people would have, that are told to exclusively breastfeed their children, mothers that are HIV positive. But they say because they don't have enough food, they're not able to produce enough milk for their infants, so they end up giving them solid food, which of course exposes the children the socioeconomic issues around HIV and AIDS. How do we deal with that specifically?
So that's a major and very important factor. Yes, we try to reduce the medication. I know most countries and most governments have tried to reduce the cost of medication so that people can access them or afford. Now, the issue of, are people empowered, especially women and girls, are they empowered to actually not just buy the medication, but take care of their health, other aspects of their health as well? Because we know that HIV affects your health in totality. Are they taking care of other aspects of their health? And that's where not just the government agencies, but then the government and then institutions come in, provide jobs for the people. They are working, they are able to fund for themselves, take better care of their health, and be able to follow through with all the things that are needed to be able to reduce their risk of HIV or even reduce the progression to AIDS. Now, certain people are led into getting HIV due to socioeconomic issues. Some people would say, I was led into prostitution because I don't have money to fend for myself, and that is how they got the disease. And so, yes, that is a major factor. And that's why most communities and most institutions and most agencies don't work alone, but they like to work with governments as well, private sector, to try and encourage them to help empower people financially such that when the medications are given to them, they take care of other aspects of their health, and then they're able to reduce the progression of the HIV to AIDS. So it's very important that you raise that because it's a very major issue as well.
And Dr. Hannah, let's talk about the issue of prevention and all the new medication. I mean, there's been a breakthrough when it comes to medication around HIV and AIDS. Just a few minutes before I spoke to you, some of the members of the community are saying we want to be able to be put on longer term medication so it doesn't disrupt our day-to-day lives. People that have to go to work, not having to queue at public hospitals and clinics for hours on end, missing out on work. Also on the prevention side, medication that reduces the risk of getting HIV and AIDS. How far have we come with that? And what is currently in the market and how effective is it?
Yeah, so most of the medications, actually in most African countries, the post-exposure prophylaxis, that's when you have been exposed to it and you want to reduce the risk, are actually limited to those who are at higher risk. So those who are in the health sector and those who are at a higher risk of getting contracted or getting infected with the disease, especially because of finances, because of the numbers that we have and because of the quantity. So it's not available to everyone. So that's where the advocacy comes in, that we get more and then we can spread it out to more. The other issue is that we don't want to encourage promiscuity amongst people. So when people find out that there's drugs for prevention, then there's going to be a lot of promiscuity and they don't like to take responsibility for their actions. And then it's going to spread. So that's why we encourage people, look more at preventing the disease through your lifestyle than just through medications. You know the things that you do that put you at risk. So look at reducing the disease in those aspects as well. And that's why the education comes in. Now, concerns raised about wanting the medicine for a very long term. Yes, I get where they are coming from, but for us, the health facilities or in the health sector as well, the reason you come for the medicine during periods, it's not just because you're coming for the medicine, but also because we need to review you. So after 3 months, after most people are put on 3 months, after 6 months, we need to see the patient. We need to see how well you're doing. We need to do labs to see whether your viral load has reduced and all of that. So it's not just about giving the medication. That's one thing that we want people to understand. It's not just about receiving the medication, but it's also so that we can see you, review you, and see how well you're progressing on the drugs. And that's why sometimes we ask you to come back after a period. So that's just something I'd like to chip in, that it's not that we don't want to give you the medicines for a very long period, but it's so that we can also see you and review your progress on the drugs.
And Dr. Hannah, in the broader context of health equity, I heard you talking about how certain prevention medicine when it comes to HIV is only available to people that are higher risk. But if we are to reach these numbers, these targets that the United Nations speaks of perhaps eventually eliminating HIV and AIDS, shouldn't that medication just be open to everyone who really feels that they need it and they want it and they just want to avoid the risk altogether 100%?
I understand where you're coming from, but there are so many ways to prevent the disease aside from medications through your lifestyle. So why do people just, if you want to prevent the medication, why don't you change your life to prevent the medication rather than just looking for drugs? That's another line of argument as well. There's so much you can do to prevent the medication, to prevent the disease, like having safe sex, protecting yourself, avoiding unsterilized use, unsterilized needles. Yes, so there's so many things to do. The medicine is available. If it's available in large quantity, of course, we'll give it to everybody. But here's the challenge as well. It's not available in large quantity. So obviously, the most rational thing to do would be to keep it for people who are at extremely high risk and encourage every other person to choose the easier option, which is, of course, the lifestyle changes. Because in as much as we are talking about these drugs, some people are not even able to go through with the drugs because of the side effects. Some people vomit the whole time. They have to use the washroom the whole time. It's quite uncomfortable. I'm talking about the post-exposure, the preventive ones. So it's some people are not even able to go on the medication for the long time because of the side effects. And that's why I would encourage you to make lifestyle choices that will prevent you from getting the disease rather than just waiting for medications to help you prevent the disease.
All right, let's talk about what perhaps the medical sector and scientists have learned about how HIV attacks the body. Is there anything new that has been learned, and is that what has contributed to this new medicine that we're seeing on the market?
Well, I think the good news is that we've had people who are getting very low viral loads, and that's good news. That's a breakthrough, because then there are some people who have gotten to very, very low undetectable viral loads, and they're unable to transfer it to others. The antiretroviral drugs available are very good. They are working. It's just that there's lack of consistency in taking them. Some people due to stigmatization, some people due to forgetfulness, some people get depressed and don't want to be on the medication, and some people just get tired of taking them. But for those who have taken the medicine for a very long time, we've been able to get people who have very, very undetectable viral loads, meaning that they can be with partners and not be able to transfer the disease to them. So those are the breakthrough news in the medications.